Guys, welcome to another
Hello,
video.
and welcome to Surgery Squad's virtual ingrown toenail removal.
So this is
I'm
what
Dr.
we're
Jeff,
today.
and
Hi
I'll
Jeff,
be guiding
my
you
name
through
is
this
Jeff.
procedure today.
So let's do this,
An
guys.
ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail.
Okay.
An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain. But remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one.
Oh no.
Our patient is ready, so let's begin by disinfecting the toe.
I'm gonna make him like orange so he's like tan and shit. Oh my god. It's a bit of lag, sorry about that. I'm using the new software, so recorder software, so tell me how, like, if it's good or something, I don't know. Oh no, this is so laggy.
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Okay. Can I do his other toes? Oh no, I can't. Oh, it's got hurt. It's got hurt, bruv. Just hurry up and do it. Come on, let's cut.
Great. Now we'll wait a few minutes for the toe to get numb.
5 minutes later.
Now that our patient's toe is numb, place the special tourniquet around the toe.
What?
This will help reduce the amount of blood coming from the wound.
I'm ready. Let me do it. I'm ready to stop talking.
First, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
No. Oh, do you hear that noise? Shit.
Great. No. Take the forceps and carefully remove the ingrown nail.
Holy no! No! It's fucking disgusting.
It's getting kind of messy in there. Let's clean up that blood.
Oh my days. Tell me if you like it in comments below.
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of...
Your hand's fucked. I'm gonna be sick.
That toe is starting to look much better.
No,
we're not done yet.
Yeah, sure.
Next, we're going to apply some phenol acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in the toe.
Acid burn shit.
When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Is he still awake? Like, that's gotta be painful. Fucking hell. Why can't you just...
Finish by applying some antibiotic ointment on a sterile gauze pad.
Yeah, I did it.
Place it against the toe and wrap it in a gauze bandage.
I'm not even doing anything. That's not fair. The game's doing it for me. Alright, it's all good.
Fantastic job.
I can still see the...
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day.
Alright.
While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper-fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail.
Right, Jeff.
You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Never done this. I'm going to do 2 and then that's it, guys. So, yeah. Not even sure how much I've been recording for, but Here we go. I've got a fast computer, so like quite fast. But if you've got a rubbish computer, you know, well, not too good computer.
Welcome to
like
Surgery Squad's virtual root canal procedure.
Oh my God.
I'm the one and only Dr. Jeff, and I'll be
Jeff?
helping you with this surgery today.
Is that a new doctor?
A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth.
My nan's coming up.
During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection. Our patient today is having a root canal performed on their lower right second premolar. A dental professional may refer to this tooth as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
Nope. No thanks.
No problem. Let's move on. In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause. Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on.
I'm spitting everywhere. It's fucking... Oh, bro.
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
Oh, no, not the needle. Oh, 5 minutes. Yeah, please.
Now that the patient's mouth is numbed, we can move on to isolating the tooth.
Oh, geez.
Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Oh, shit. All right. Are you ready? Whoa!
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
Oh shit, what is that? That looks painful.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe.
What's that? Is it this? What the fuck? That's water, bitch.
So far, so good.
I thought you said...
Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
What the fuck? That looks painful as fuck.
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
Oh shit. Oh, am I cutting it off or something? What the fuck am I doing?
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. Wow. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
I'll leave the link in the description if you want to try it out.
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
5 minutes later? What is it with you 5 minutes later? Shut up!
Now use the suction to remove the bleach from the patient's tooth.
Right. What's this? Sucky sucky? Is that actually sucking it? Oh, wow.
Next, we'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth.
I've learned shit.
I've already added some sealant to the gutta percha cone.
Alright, let's go. I like
Looking
this game.
good.
What is that, like a fake cigarette?
Instrument is now used to remove the excess gutta percha.
No, this looks really painful. What is the
Pack the gutta percha into the tooth canal using a plugger.
What are you doing? The fuck is that?
After the gutta percha has been placed,
who the fuck is she?
It is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown